Well, thank you for joining us. Please do come and take a seat. Don't feel shy at the back. My name is Dr. Rowland Illing. I am the Chief Medical Officer and Director for Global Healthcare and Nonprofits at AWS. And I'm also an interventional academic radiologist by background, so I've experienced life at the sharp end as well. I'm delighted to be joined today by Parminder, who leads AI, is the Chief AI Officer for GE Healthcare, and has insights that we will extract from him over the next half an hour around what GE is doing with AI, your views on how AI should be implemented, some of the regulatory challenges, and also what GE is doing more broadly, not just because GE is obviously the enterprise imaging leader around the world, but also GE has other strings to its bow. So I'll be very interested to explore that and to understand where it's going.
Yeah, looking forward to the discussion today.
Great. Would you mind giving a little bit of background about yourself, just to frame it for the audience so they get to know you a little bit better?
Sure. So, hey everyone, this is Ferry. I'm the Chief AI Officer at GE Healthcare. I've been at GE Healthcare for about a year. I lead all of the AI across all of our businesses. So imaging, ultrasound, PCS, as well as like looking into our digital and multimodal capabilities as we are getting into the next phase of digital transformation and other components as well. Focus on operational efficiency side of things. So we have a lot of products. We'll talk about those. How do we enable, accelerate those capabilities in, and then kind of focusing like how do we envision with precision care, where at G Healthcare, our strategy is around D3, which is how do we make our devices smarter, which has been something we've been doing for the last 10, 20 years. How do we make it more disease state focused, which is powered by digital and AI as well. So we'll cover some of those areas as well.
Perfect, thank you. And I don't think anyone can go anywhere at the moment without hearing the words generative AI or foundation model. I think I don't know. Apparently, it's a hot topic, and I'd be really interested to understand how GE is addressing this topic of foundation models. You know, how do you see foundation models really changing the landscape for healthcare, and in particular, how will you measure success? What does success look like for foundation models in GE?
Sure. Yeah, in a bit of broader context, a year back I was leading Bedrock at Amazon, which was like a lot of these foundation models. So I think for as we start to get over here, I think last 18 months have been really revolutionary in healthcare in a lot of ways, especially with some of these new models with ChatGPT and others coming in. We have had a lot more discussions now than in the past around AI and how it can be integrated into the workflow. So I think we are getting into that direction where there's a lot of discussions that's happening on how AI is not something of a phase, but it is actually part of the product that gets integrated as well. Specifically in healthcare, I mean, 30% of the world's data is healthcare. 97% is still not utilized. So there's huge potential with AI to actually utilize that data for efficient patient care. And predominantly, a big part of that 90% is medical imaging. So that becomes an important component. But tying it back to, I think, like more disease state focus, like, yes, we can make our devices smarter, and we'll talk about that as well. But part of it is like, let's go through, let's say, a care pathway in oncology, let's say, for instance, in breast cancer. A patient will have to go through a screening, assessment, treatment, planning, diagnosis, and there are multiple devices that happen across the ecosystem. All of them are spreading out a lot of data, but it is kind of spread out as well. So I think where foundation models become key is like how multimodal AI or multimodal healthcare can actually be leveraged, and that's where foundation models kind of become key in a lot of ways as well. For instance, we can think of foundation models as horizontal capability, which can help accelerate across multiple care areas. So once we build solutions for breast cancer, can we translate that to prostate cancer, lung cancer in like zero shot, few shot settings? And then even across different care pathways, going from oncology to cardiology and even into neurology, that's one of the scale component that brings out. And then the other aspect is the vertical aspect, like how do we stitch data that's going to be used in screening, that's going to be used in diagnosis, treatment planning, all of these devices are talking to each other. They're not talking right now, but they need to be interacting. And I think AI becomes that common language in a lot of ways as well. So I think there's a lot of value where we can actually use foundation models. So imagine if we have to see what was the therapy given to the patient 2 months back, what was his response in last 6 months, what were the diagnoses that were treated or found out. There's a common set of questions that actually stitch across any care area. So I think that's where foundation models, which can actually help you get this answer really quickly, stitching the dot across screening, across diagnosis, treatment planning, kind of creating that connecting the dots, which helps clinicians spend more time with the patients versus having to go back and forth between multiple workstations.
So that's a concrete use case you're
Yeah.
giving there, which is patient record summarization from multiple data sources in order to reduce provider burnout, essentially. So instead of having to try and trawl through notes and summarize records, it's provided to them at the point of need. And I guess that also isn't just about care providers. That you could also use that example for radiologists.
Yeah.
So if they're trying to write a report for a patient and they need to understand the background of the patient in order to do the report, this could also be used as a tool to help radiologists work faster as well.
Yeah, definitely. And I think the second use case is at G Healthcare, like my teams are working on across 200 plus AI machine learning projects. We have 58 plus FDA approved AI enabled authorizations, which is highest in the space as well. And part of it is like, how do we accelerate the process of building these capabilities 10x faster? So one of the things, for instance, last year we launched a product called as CT deep learning auto segmentation, which goes into the radiology persona to identify organs at risk so that radiation therapy can actually be given to the tumor and not on the organs. Part of the entire life cycle, I think if you look into this workflow, they spend about 3 hours manually contouring these organs at risk, which is not the best use of time. We actually built a model which is 510K cleared, which is a CT deep learning auto segmentation algorithm that reduces this time from 3 hours to 10 minutes. And I think how this model was built is also another thing where foundation models become, because in the past you would do one organ, 5 organs at a time. But how we built this was 5 plus different anatomies, 50 plus different organs in single shot. So we're talking about 3 to 5 years of roadmap of product, all being condensed in 1 year. I think that's another time to market, and bringing these
Yeah.
capabilities faster is another area.
And I think you touched on an important point, which there are many different models available. There are lots of foundation models also becoming available. And so one of the ways that AWS is certainly approaching foundation models is to democratize access to foundation models for the broadest set of uses, because there won't be one foundation model to rule them all. And obviously you're very familiar with Bedrock on AWS, which allows access to different foundation models for different use cases. So is that something that GE will be leveraging and part of that suite of tools that you're bringing out?
Yeah, I think it's going to be a synergy of capabilities where part of it is what we can use and build on top of that. I'll give an example. We had a research work that was done as part of one of our first work in foundation models in ultrasound, which we published about a few months back. It's called as SonoSam. It was built on the SAM technology for segment anything, but tailored. But what we found was off the shelf for ultrasound, it had less than 60% accuracy. We trained it more on ultrasound datasets across different modalities, across different use cases, across different probes. And what we found was we were able to increase the accuracy from 60% to 90%. But I think how these models change from the models in the past as well, the model was never trained, for instance, on breast lesion. It still had 90% accuracy on that. And I think that's the advantage of these technologies. Now, if someone is building an application in care pathway specifically around mammo care areas, you can easily start with a model which is already 90% versus starting from something scratch, getting the data,
Yeah.
and then kind of focusing more towards the evaluation of these technologies. And I think like as chat became the interface for large language model, for imaging, it's all about visualizing these capabilities. So I think that interface is going to be important. How do you bring in these multimodal or even vision foundation models into the play? So there's a lot of areas where there is collaboration. You can think of taking things from which are already out there, like large language models. You would take them, tune that for those settings. But in some of the cases, as part of G Healthcare, we're also like, because imaging is one of the core components on the vision side, we're actually investing heavily in building these models. Because once, for instance, what we have started with ultrasound, now can we translate that to CT? Can we translate that to
Sure.
MR and other modalities as well?
So it's interesting. So when we talk about the value of foundation models and how you see what a good outcome is, I guess it's really just using AI as a tool, as an automation tool, and all of the outcomes that you're seeing are actually all the outcomes that we want to have in healthcare anyway. So better patient experience, easier user experience for doctors, more efficiency of operations. So all of these things that have always been the case of what good KPIs look like will remain good KPIs. They'll just be accelerated and optimized through the use of this technology.
Yes, and I think you touched upon a very good point on like how do we augment the current skill. One of the directions where we are looking into it from ultrasound, for instance, there is a widespread need for sonographers with a lot of experience to take a diagnostic quality ultrasound images, and there is a varying set of skills that you might find. Now, one of the areas where AI and foundation models can really be useful is, can we build technology that can bring a sonographer with 15 years experience on the similar leveling field as sonographer with 1 year experience? So what we have integrated into our ultrasound device, which is called as caption guidance, what it gives you is like a co-pilot experience where, hey, you're taking a diagnostic quality image, move a little left, move a little right, move a little up. That way you can, now you have 80% or 90% confidence that you're actually getting a diagnostic quality image. So I think AI is kind of embedded, and I think the advantage of using AI is when you don't think about AI, you think about the use cases as you bring out
And, I,
use
and, I,
cases
and
as
that,
well.
that also touched on a really interesting point about compliance and regulation, because obviously this is a highly regulated industry. Healthcare is incredibly important to get the healthcare data being used appropriately. What's your view and what's GE's view about that regulatory status? 'Cause I know in Europe, for instance, with the AI Act, they've kind of broken this down into three areas. They've broken it down into the most risky AI, which shouldn't be used. So these are things like racial profiling and AI to do things which are highly contentious, which they say we shouldn't do. Then there's the middle tier of highly regulated AI, such as healthcare clinical data for clinical decision support. And then there's the least risky AI, which is more about operational efficiency, and it's less prone to, it doesn't rely on that clinical aspect and using healthcare data directly. So how's GE thinking about the regulatory side and the use of data?
Yeah, I think AI in medical imaging has been, and especially in radiology, has been one of the early adopters of AI, where we have seen in the last 15 to 20 years, it's been adopted, integrated into the workflow. Even as I talked about at the G Healthcare, we have the highest number of FDA approved apt authorizations on the medical devices, and its number is scaling and increasing. So the process has been there for last 20 years, where how AI, machine learning, and deep learning can be integrated into the workflow. As we have built those capabilities in, I think it has helped us to scale these technologies or those capabilities, like to build that what we can call as a QA/RA or a regulatory muscle internally as well. So, for instance, to actually identify, making sure all the data is built out or trained in a compliant manner, which is HIPAA eligible, which is GDPR compliant as well. So, making sure those basics are kind of adhered to, and then that's where I think a lot of capabilities from cloud becomes useful. Like, you don't want to reinvent the wheel, right? You would want to leverage that and add value where you can truly differentiate, and I think that that's the key area of focus from G Healthcare as well. How do we leverage cloud scalable technologies in a way which can really help us scale? So if I talk about the AI journey, we have a process on data annotation, data storage, making sure all the guardrails are taken into account, training the models, validating, and even providing transparency on compliance perspective. Like, you can actually track which data was used for training which model. That way, if there's any follow-up, you can actually iterate and improve on those models. Now, building all of these capabilities has taken us like a lot of time across the last decade, but now it has become a muscle. So 70 to 80% of the regulatory components that are required to get there are kind of automated with the tools that we have built on cloud, and like kind of accelerating from that aspect. And then now the idea is you're actually focusing on that last mile focus. Okay, there's an application that we need to build. 70% of the documentation, 70% of the things that are required from compliance is already there, and you can take it to the next level. It's an interesting phase, I think, with Gen AI and foundation models. I think like FDA has done great work, I would say, in the last 20 years to get that checklist so that everyone feels confident that these are the areas that you need to focus on, making sure building the AI algorithm, I would say, is 10 to 20% of the time. Validating it takes 70, because you need to validate at multiple sites to make it
Absolutely.
time ready. So I think that becomes a key component to kind of adhere to those standards. And I think like as you bring out the balance on what are the things that you want to build and scale versus what are the things that you can use as reusable components becomes a really important discussion.
And I think that's, again, that piece around how you build out and how you scale. And again, the choice that GE made to platform on AWS, I think is really important because, again, as a clinician, I want to make sure that my systems actually come on when I turn them on. And so having the most robust and available cloud globally, so we have less than half the outages of the next most available cloud and less than third of the downtime, I think having that platform that you can trust and then you don't need to worry about in terms of the components you know are going to have that fundamental regulatory compliance in the regions that they are in, so you can then focus on the higher order solution building without worrying about the underlying infrastructure, I think is really important bit of synergy between GE and AWS. A lot of talk is about responsible AI. So what does responsible AI mean to you? Is that the same as compliance or is...
No. I think the responsible AI has a lot components. I think like responsible AI as a pillar, we've been talking for last 10 years, like minimizing the bias, making sure there is trust, privacy, and all those components, and all of those still hold true. I think these foundation models in generative AI throw us into a new paradigm, which is uncharted territory in a lot of ways as well. But talking about, I think what the first part is on like how do we minimize the bias, because I think that's one of the key areas. So for that, we need to understand how are the current generation of models being built. We're talking about a lot of AI algorithms that are being built with 200 studies, 500 studies
Yeah.
that are coming out. So the way foundation models can actually help, because you're training a foundation that's trained on a wide array of population, it is covering different demographics and then tuning for specific use cases. So in a way, it actually helps on those pillars where you're trying to minimize some of the components in a way as well. But there are areas where there requires more focus, especially when we go to generative AI and foundation models. For instance, when we are starting to go into the directions of how do we actually, I mean, around model explainability, for instance, like, and I think that's going to become even more challenging with Gen AI and foundation models. But I think the way for us to think is like, how do we bring in, take these models outside of being a black box, but more providing explanation of why model generated that
Yes.
output, kind of giving more trust into the system for our clinicians as well as regulatory body. So one way to think about this is with Google search, when we search that, I mean, we are searching, we are getting the output, but we also know where the information came from. As long as we can kind of validate and bring in that technology in, some of the capabilities that get built out, it gives us more trust because now you're able to bring out where the data or the source came from, and it's not just the generation that being looked
I
into.
think that's a really interesting use case. I don't know how many of you use Perplexity AI. Have you used Perplexity? It's the next generation of search. Have a look at it on your phone. You can download the app, and it uses foundation models. Runs on AWS, and it's a really elegant search. And it cites the sources as well. And I think if you can bring this kind of capability into the medical domain under a regulatory framework supported by GE, this is really interesting. Now I'm aware we're coming to the end of time, but just very briefly, I know GE is thinking about enterprise imaging. That's what GE is known for. What other areas is GE getting into now? Because it's you're diversifying in terms of outside imaging. So just maybe in a minute, just talk about some of the areas of focus you're looking at the moment.
Yeah, I think focus is on building open like most of the product themes is around building open architectures that can allow us to really scale and bring in collaborative synergies as well. So I think one of the examples and couple of them which are at showcase over here is, for instance, CardioVisio. What it does is it's used for AFib management for clinicians, and where you're able to combine data that is coming from medical imaging, coming from waveform, as well as from EHRs as well, kind of giving them the longitudinal view of the patient. That way, guidelines can actually be applied on them in a meaningful way. So that's a way of how do you provide that longitudinal view for a patient. That way, you can actually take action in real time in a lot of those areas. The other area is more around operational efficiency. A constant theme I think that we have been hearing around is how do we improve, for instance, better reducing length of stay, making sure can we identify when the beds are going to be free, identifying and who should be added. Is it going to be from someone from ED or other patients? How do we prioritize that? So one of the products that we have, which is called as Command Center, that's used for basically scaling these operational efficiency. It's already out there in 300 plus hospitals. It's deployed in statewide facilities in some of the cases as well. So now you can look into not just at the facility level bedside, but across the end of spectrum, where you can see which hospitals might have some bandwidth to be able to take new patients in a way as well. We did some collaboration with MGB around missed care opportunity, which is what it means is, can we make the scheduling more streamlined, where if we know a patient is not going to be going for an MR scan, can we predict that before? That way we can make the process more adaptive with time as well. So that's another area where we can really streamline the process and make it more flexible. So any urgent care patient can actually be added into the workflow. The model has 96% plus accuracy when we initially built it with MGB as well. So I think that's another area that we have looked into. The third is remote monitoring. I think that's becoming key as well. So we have what's called as portrait mobile remote monitoring. And I think one of the areas is, how do we take care or continuous monitoring outside of the ICU, but actually to bring it to like other areas as well, like ORs and others as well. I think that's the area where this continuous monitoring, so that you can see when the patient is deteriorating and kind of bring them back as well. And because it's been built with open systems and architecture, it can interact with all of different components. Earlier this year, we actually announced our agreement collaboration with bioinformatics. So now you can take it not just within the hospital, but take the same capabilities outside the hospital, creating the longitudinal view for the patient across the timeline as well.
Fantastic. I think that's really interesting. I think there are, so my takeaways from this chat we've had in the last half an hour is, first of all, GE is going to be infusing all of the things it's building. So Command Center has been around for a long time, but also going to remote patient monitoring and obviously imaging. AI is going to be infused into all of these things to make it smarter and faster and more automated. I think it's really, really interesting. I think it's first also interesting that GE is actually broadening its offerings into going into other areas like cardiology. I think that's also super interesting. We can't wait to see the other disciplines that goes into. I think the partnership between GE and AWS is really powerful. And I think platforming one of the most incumbent technology companies delivering patient care on top of the broadest, most widely adopted cloud platform is a really potent combination. And so I'm really looking forward to seeing where these two companies can go together. And I'd just like to thank you for being able to explain all of that to the audience. And thank you very much, Parminder, for sharing your wit and wisdom for today. So I'd like to thank everyone to say thank you to Parminder for joining.
Thanks, everyone. Thanks.